Your abs are not your core. Who doesn't love the way a chiseled six pack looks on a handsome man or woman? It's been labeled as the holy grail of fitness in some circles. You can have chicken legs and a spaghetti back, weigh 110 pounds soaking wet, but if you have a six pack, you must be fit. I hate to break it to you guys, but in 18 years of coaching, I have never done a single abdominal exercise that helped me run faster, lift heavier, or jump higher. And when my back was hurting, doing anything ab related was the furthest from my mind. Yet we live in a culture that glorifies the abdominals, and we have practitioners who tell people their back pain is stemming from ab weakness and advise them to do core exercises, which translates to a bunch of sit-ups. Sit-up type of exercises can be disastrous for those who have tight hip flexors because the hip flexors will initiate most of the movement. You are now working chronically tight and stressed out hip flexors even harder, thus persisting your back pain. A simple releasing of the hip flexors combined with a strengthening of the lower lumbar muscles, glutes, and hamstrings is a much more effective option. Now, does this mean we totally neglect the abdominal muscles and never train them? No. Every muscle in the body should be trained to be strong and effective. Sit-ups and direct abdominal training is simply not the best way to get rid of your back pain. Your real core is what I call your hip flexors, quadratus lumborum, gluteal muscles, and your hamstring. Take one of those muscles away and you take away your movement. Think about it. Nobody calls into work sick with sore abdominals. No one says, this chair is really killing my abs. Tight hip flexors bring your head closer to your hips, rendering the abdominals ineffective at supporting your organs and your lower back. Strengthening them without addressing your tight hip flexors will not improve your posture or position. And one last thing, stop referring to them as your core. You don't have back pain, you have a butt problem. You heard me refer to these mysterious muscles known as the glutes for a while now. If you knew what I was talking about, great, this will expand your knowledge. If you had no idea what I was talking about, you are in for a treat. The glutes are comprised of three muscles, the gluteus minimus, gluteus medius, the gluteus maximus. To make things more interesting, we have four parts to our gluteus maximus, which are the lateral part of the lateral, the medial part of the lateral part of the medial, and the medial part of the medial. We will learn how to target these areas in our strengthening section. The primary point we need to understand in this section is how our glutes affect the function of our low back. When we take a step, muscular force is not transferred straight up the body. Rather, when it reaches the glute of the side that the foot is in contact with the floor, it then crosses over to the other side of the back on up to the shoulder. To put it plainly, our bodies function in an X pattern as illustrated in the diagram below. And this basically just shows a gentleman right there. Force goes into the right foot, goes up to the right glute, gets transferred to the left shoulder. Same for the other side. You can test this very easily if you want by walking with the backs of your hands on your lower back. Feel which side of your back contracts when you walk compared to which foot you have on the ground. When your left foot strikes the ground, you will feel a contraction in your right lower back. And when your right foot hits the ground, you will feel a contraction in your left lower back. Having your body function this way is very efficient and allows for a smooth gait pattern. If the right glute and right low back fired at the same time, we would all be walking like penguins, and penguins do not walk very fast or very efficiently. As we discussed earlier, though, human beings do not move correctly 100% of the time. We all have faults, myself included, and when we rely too much on one leg or have trauma incurred on one side of the body, we develop a deficiency that will then hinder how our back functions. When the dysfunction first occurs, the back says, hey, no problem, I got this. But after a couple of months or a couple of years, depending on how much stress you put on your back, it will eventually come to a breaking point where pain is produced. Remember, your entire body system is a yes man. It will keep doing what you ask of it till the structure no longer holds. When we start feeling pain, we have had a problem for some time, and this then takes us time to reverse. In most cases, what happens is one glute will get tight, the other glute will get weak, and the more unilaterally we become imbalanced, the more taxing it becomes on the lower back. Close to 95% of all back pain cases I treat are cured by not even touching the back. We spend most of our time correcting the hips, When the hips are corrected, the stress on the back alleviates and you become a happy camper. Correcting the glutes is tricky as there are 3 separate areas we need to work on with absolute precision. Just rolling around on your butt without an objective will get you nowhere. With that said, let's take a close look at each one of these muscles, starting with my favorite, the gluteus minimus. So I know that, I'm showing you guys the pictures, and I'm not trying to just plug you to say, hey, you got to buy the book. Buy the e-copy, buy the ebook if you want, just so you can get better pictures of these. But the glute minimus is on the side of the hip, okay, right here. And this guy is going to connect your crest of your hip with your femur, the largest bone in your body, okay? Really small guy for a really big job. To get a feeling of what it is like when this when it is tight, think about putting on a pair of pants that are 2 sizes too small for you. Then put a belt on and tighten that sucker as much as you can, sucking in your stomach even. Once all of that is accomplished, try bending over or even doing a simple squat. Impossible, right? That is the damage this little guy can cause. Many people will also suffer from what I call fake sciatica, in which the subject will have pain radiating down their leg, sometimes to their foot, yet their flexibility checks out. No tight hamstrings, no tight glute muscles or hip muscles. These people are prescribed painkillers and muscle relaxers and sent on their way, when a little pressure at their hip would relieve all. Too simple, I suppose. The gluteus minimus internally rotates your thigh and also abducts it, which means it moves your leg away from the midline of the body. It is a very, very active muscle stabilizing the pelvis to the femur and contracts every time you shift your weight from side to side. Shifting your weight to one leg while standing will stress this guy out. So will long trips on planes, trains, and automobiles. Releasing it can be very entertaining because of where it will send pain. It is somewhat of a rogue muscle in that respect, but when we do get it to release, it will feel like you squirted a quart of oil in your back. The gluteus medius. These guys are a little bit thicker and they'll cause a little bit less pain when they're tight. Really, for the most part, when they're tighter, they have active trigger points in them. They will really shore up and shorten up the hamstring muscles. The gluteus medius muscle, as you can see by where it originates and where it inserts, can hugely be affected by the health of our back. Can hugely affect the health of our back. If one side decides to get tighter than the other, our pelvis will become uneven and boom, we have back pain. The gluteus medius wears many hats. It helps to flex and internally rotate the hip, as well as extends and externally rotates the hip. It also abducts the leg, moving it away from the midline of the body, as well as stabilizes the pelvis when shifting weight, i.e., placing all of your weight on one leg while waiting in line at Macy's. We can develop trigger points in the gluteus medius that will send pain right into our lower back and coccyx region. This guy will also refer a lot of pain down into the hamstring as well and can be very tender to even lay a finger on, but doing so will reap big rewards, lessening our back and hip pain. The gluteus maximus. This is the meat of the butt. Development of the gluteus maximus is what has allowed human beings to stand upright and separate us from our primate ancestors. The gluteus maximus is one of the strongest muscles in the body and also consumes the most calories when being activated, but you wouldn't know it looking at contemporary American society. As an outsider looking in, you would think it was just a large pad to cushion our pelvis as we sit all day long in various seats of either modalities of transportation or workspaces. While it does not contain any trigger points that will actively cause back pain, neglecting to stimulate the gluteus maximus muscle will cause it to atrophy or decrease in size and weaken, which will place more stress on the lower back muscles to keep the spine erect. Case in point, you never see an elderly person who has C-spine and large gluteus muscles. Their back literally blends in with their tush. The primary gig of the gluteus maximus is to extend the hips, which make it a prime mover in walking and standing from a seated position. I hope you like your rump nice and hot because we will be doing plenty of exercises that will stimulate it in ways you never thought possible. The hamstrings. You should be familiar with these. The muscles that go from your butt down to the back of your knee. technically called the biceps femoris. The hamstrings have not two, not even three, but four muscles, as you can see in the picture. I think it was one of those times where we may have named something before we actually studied it, but I digress. The hamstrings are important because they are called upon second to help the glutes do their job before the back is. The correct firing order is gluteal first, ipsilateral or same side hamstring second, contralateral or opposite side low back muscles third. When the hamstring is tight or weak and not doing its job properly, who do you think picks up the slack? Your good old friend, the lower back. That's who. Frequent and prolonged sitting can easily create trigger points in your hamstrings, tightening them more and more, rendering them completely useless. Doing a yoga class or two may show signs of improvement, but continued stretching of trigger points, laden hamstrings, will only tighten and compress the notch, which will then start sending pain into the calf muscle, leaving practitioners really confused and you really frustrated. We need pressure to release the trigger points. Only then can we start to stretch them and return them to a happy length. Bonus, the deep muscles of the pelvis, as you can see right there. While not contributors to too much back pain, the deep muscles are worth noting because if they are tight, they will cause the foot to turn out in our no-no duck walking fashion. Traditional tests for glute tightness will check out okay, but subjects will only be able to achieve partial ranges of motion in a squat at best. Forcing beyond a 90-degree knee position in a squat will be impossible unless one turns their feet out sharply. This will cause a tremendous amount of instability at the knee and way more than normal hip flexion in order to get down deep enough. Access to these guys is tough because of the thickness of the gluteus maximus and is best addressed by a manual therapist. This doesn't mean you can't roll a cross ball on them in your spare time, though, and get acquainted. I call them generically your deep rotators, but here are their specific names. Piriformis. Most of you have heard of this guy because when he tightens, he puts pressure on the sciatic nerve, which is not fun. Superior and inferior gemellus. These guys literally rotate your thigh. When these tighten, your foot position will become altered to the dreaded duck position. Obturator internus laterally rotates femur, pointing the toes out again. Quadratus femoris, another lateral rotator of the thigh and hip stabilizer. Although this section may seem pretty straightforward, there are plenty of gems hidden in here. The better you understand this chapter, the better you will be able to sense your own tightness and ultimately your own path to wellness. Without further delay, let's get to the fun stuff now. Ask the coach. This is a big one. I want you to listen to this really, really intently. What about icing my back? Without any of this prior knowledge, I made one of the greatest mistakes of my life when my back was hurt. I actually used heat, not ice. With all the confusion surrounding my injury, I reduced myself to electrical stem treatments in the athletic training room and combined it with some stretches I found on the internet. I would do these twice a day after my 6 a.m. women's basketball team and then before I exercised, upper body only, obviously, at 4 p.m. The reason I used heat was simple, for comfort. Who wants a massive bag of ice thrown on their back at 7 in the morning? After the first day I used ice, I got up from the table and started walking stiff as a board. My back almost hurt more. It did hurt more. When I switched to heat, however, it was not only more comfortable, but when I stood up from the table, I couldn't believe how loose my back felt. As a budding young physiologist, rather than overthinking the situation, I just went with what felt better. Surely I'm not just telling you to stop using ice based off of a feeling. Nope, I'm sure not. In November of 2005, an athlete of mine had received word that the Chicago Bears were coming down to watch him practice and then play in the upcoming season finale game against nationally ranked Washington State. The problem was the scouts from the Bears were coming down to see him Thursday, and he had just twisted his ankle badly in practice on Monday. He called me in a panic and quickly took to the World Wide Web to find a quick, reliable solution. All of my research led me to a book by Coach Dick Hartzell, the creator of Jump Stretch Bands, who wrote a book called Don't Ice That Ankle Sprained. In the book, Coach Hartzell explains how ice constricts blood vessels, restricting blood flow to the ankle as it tries to heal. He recommended heat and some mobility work with bands in order to free up the ankle from its injury and help return it its much-needed proprioception. The technique worked like a charm. My athlete hobbled into my apartment, and after about an hour of the band work and some light massage around the calf and ankle, he was sprinting at 90% capacity and up and down my hallway. I was amazed. If you haven't gotten the feeling by now, let me come right out and tell you I'm a physiology rebel. I don't really like tradition or following in someone else's footsteps. I want to be on the cutting edge of treatment or blazing a path for others to follow. I love debunking myths and succeeding where others with more illustrious credentials have failed. I've had my athletes and patients practice what I have taught them in a public gym, and they always come back to me and tell me how someone with some kind of certification told them what they are doing to their shoulder, knee, back, etc. is not good for them. I instruct those who work with me to politely say thank you for your help and never to argue with them. They don't know what they don't know, and it's not their fault. I now never use ice in any situation except post-operation to 12 hours after and in the knee only. All other situations, I instruct people to use heat mobility or self-applied massage only, and here's why. In 2012, a study in the British Journal of Sports Medicine showed that there is no clinical evidence ice improves the healing of muscle strains. Consequently, there was also a study published in the 2013 Journal of Strength and Conditioning Research showing that icing can actually hinder recovery from eccentric muscle work. In another study in 2013 involving 11 20-year-old male baseball players, topical cooling caused a significant increase in muscle damage markers during recovery from eccentric exercise. All the pictures you see of athletes wrapping body parts in ice post-workout or post-game seems silly now, doesn't it? In all honesty, it should be illegal. A $20 million a year athlete doing damage to his body willingly through ice. Let us continue though. A research study published in 2012 by the Journal of Sports Medicine showed that in 25 separate studies, 75% of them reported a decrease in muscular strength following icing. There was also evidence from 6 studies that cooling adversely affected speed, power, and agility-based running tasks. So when Jimmy, the high school running back, bangs his knee, gets a pile of ice thrown on it, and then returns to the game like a champ, we are asking for further injury to the area. Icing is really just a great placebo effect. It is great at decreasing pain, no doubt, but in the process, we are not letting our body heal correctly. When an injury occurs, the body's repair mechanism comes in the form of inflammation, which contains all of the healing components. Why do we want to decrease the availability of these healing components by using ice and shunning inflammation? Why do we think our wisdom is greater than 4 million years of evolution? As I said before, the only time ice should be permitted is post-operation when inflammation needs to be controlled due to the invasive process of surgery. All other injuries should be heated to increase circulation and nerve conductivity. Researchers believe ice slows down nerve impulses. Mobilized in a somewhat pain-free manner and continuously massaged to prevent the formation of scar tissue and help move along the process of draining the inflammation into the lymph nodes. We also find out in an article on caringmedical.com that peripheral blood perfusion can be reduced while icing, which means that the blood vessels constrict and shut off blood flow that brings in healing cells. Depending on the duration of the icing, it can take up to several hours for the blood vessels to open back up again. This can, in effect, cause the damaged tissue to die and permanently damage the nerve. I don't know about you guys, but I like my nerves alive, not dead. There is a gigantic difference between speculation and experiment. I have had nothing but phenomenal results treating injuries, sore muscles, and joints, as well as post-op patients with heat movement and foam rolling for over 16 years now. So there you have it. You are under strict orders to get in the hot tub or your favorite Swedish or infrared sauna to help relax your pain away. So spot cooling is bad, but what about ice baths, contrast baths, or cryotherapy chambers? Well, studies show these are beneficial because you are cooling the entire body, defeating global inflammation, rather than spot reducing inflammation. Lowering body temperature by jumping in an ice bath causes the brain to think we are freezing to death, and in a last-ditch effort to survive, will release a tremendous amount of endorphins and healing agents that scour the body looking for something to repair. To recap, Global systemic cooling in the form of ice baths or cryotherapy chambers are good, whereas spot treating with ice is a great placebo effect, can prolong injury, and even exacerbate it in the process. Next up, chapter 5, the second way your back breaks, trigger points, and lack of mobility. Thank you for listening.